Hello guys, and welcome to this video to discuss about the paranasal sinuses. Okay, so all sinuses of the face. Let's discuss about the main ones, of course, and then we have here the CBCT scan. Okay, so let's correlate 3D with 2D, and that's basically the best way to locate all of the sinuses on the CBCT scan. Okay, so now we have here the three planes. So the sagittal plane is on the left side of your screen. Now the axial plane is on the mid of your screen, and the coronal plane is of course on the right side of your screen. Okay, let's start by the axial plane. We go from top to bottom. Okay, so from the superior aspect of the face until the inferior aspect of the face. Okay, and the first one that we are seeing here is of course the frontal sinuses. Okay, so we are seeing here the frontal sinuses. Okay, so we have both of them here, and they are centralized in the middle of the axis on all the planes. Okay, on the three planes now. Okay, so now they are, of course, there is a septum dividing both of them, and they are of course behind the frontal bone. Okay, now let's go, they are anterior, of course, so a little bit more posterior and inferior we are going to find the ethmoidal cells. Okay, so I'm going downwards now, and then there you have it. So now we have all the ethmoidal cells here, and take a look at this. To see this, the ethmoidal cells in the sagittal plane, we need to deviate a little bit from the sagittal midline because they are slightly lateral to the upper concha of the nose. Okay, so that's the most important aspect for us to locate. So you have the concha, and then you have lateral to the concha the ethmoidal cells. Now you have all these ethmoidal cells here, and then the last one will be of course the sphenoidal sinus. Okay, so we have the sphenoidal sinus, and then the last one, so the sphenoidal sinus is posterior of course, and then we need to go downwards until we find the maxillary sinus. Okay, so now we have the maxillary sinuses, and they are of course inferior to the orbit and the ethmoidal cells as well. Okay, so they are on both sides, and now we are already realizing that we have an alteration here. Okay, so we are realizing that the left maxillary sinus is of course opacified or partially opacified. Okay, so we have this sinus membrane thickening here. It could be due to a dental infection or due to something else. We don't know. We still need to evaluate this scan. Okay, now let's see the ethmoidal cells again, because we have, I hope you guys realize that we have also opacification. Okay, so we have opacification of the left side as well. Now you guys are seeing on the screen properly. Okay, so always in front or anterior to the sphenoidal sinus. Okay, so that's the sphenoidal sinus, sphenoid sinus, and then that's the ethmoidal cells. Okay, so that's the ethmoidal cells, and the posterior one is the sphenoidal or sphenoid sinus. All right, so those are the sinuses of the face, the main ones, and then of course don't forget that we need to see the opacifications in all the planes. Okay, so even the nasal cavity, if we assess from this coronal plane on the right side of your screen, we have more opacification even of the nasal cavity, so that means that the concha is hypertrophic on the left side of course as well. Okay, and then we can assess and investigate this inflammation properly. So if you guys like, please hit the like button, and see you guys in the next videos.